In the 2.5 years since the World Health Organization declared COVID-19 a pandemic, we've become experts, haven't we, on virology, immunity and the Greek alphabet soup of coronavirus variants, Alpha, Beta, Delta, Omicron. Yet no one knows really what's on the horizon, what's going to happen next and when it's all going to end. Currently, as many as 2 million people in the UK may have had long COVID since the pandemic began, experiencing a range of symptoms from fatigue and muscle pain to coughs and headaches for a prolonged period of time. And some of those symptoms are much more debilitating as well. Tonight, we're going to welcome back Claire Hastie, co-founder of the Long COVID Support Group. Good evening to you, Claire.
Hi, good to be here again.
Thank you for being with us. We're also joined by Dr. Hector Bonilla, who's co-director of the Stanford Post-Acute COVID-19 Syndrome Clinic. Good evening to you.
Good evening.
And in a moment, we'll speak to a doctor who caught long COVID back in February. Claire, I'm going to start with you, though, first of all. I know you got COVID, didn't you, in the first wave of 2020, together with your children as well, who are also affected. Let's just catch up, first of all, and find out how you are and how your children are at the moment.
I'm actually doing much better than I was, thank you. Which I'm really enjoying. I still can't work to the capacity that I could before in terms of the number of days in the week and the level of pressure and cognitive pressure I had before. So I'm now earning just over half of what I was before I fell ill, but I'm grateful to be able to work at all, which I know a lot of people can't do. My children only fairly recently were starting to do really well, but then I believe they're just coming out of what I think is a reinfection, despite negative lateral flow tests. I know from lots of people anecdotally that they're not testing positive until quite a few days into their infection, if at all. My kids only just started at a new school and had to miss some time, only 2 days after they joined.
Claire, you're the co-founder of the Long COVID Support Group, which has how many members now?
We're over 55,000 members now. So yes, I set up the group, but we have our charity is Long COVID Support, and we do a lot of work in research involvement and advocacy as well as the peer support.
Yeah. In terms of peer support, I mean, tell us what your members are telling you at the moment. Of course, some of it remains the same, but there are also sometimes new questions or new comments, new experiences, shared experiences. Tell us what you're hearing at the moment.
It's actually depressingly rather similar, except more and more reinfection. And we do some of our own research, and we recently published findings, although unfortunately they were published on the same day that the Queen died. So you can imagine the media coverage was somewhat on other things. But yeah, the research we did was the first of its type, looking at the impact on reinfection on people with long COVID. And we did it alongside long COVID kids. And as you may guess, it was not good news. So people who maybe had previously had long COVID and eventually recovered then found that this existing and new symptoms came back with a vengeance. But also quite crucially, I think, we know this from our group, but I don't think it's publicly known that you can catch develop long COVID, even if you've previously recovered very rapidly and seemingly fully from previous infections. So just because you've recovered before doesn't mean you're off the hook.
Yeah, and I'm sure you'll be hearing lots of testimony. Claire, thank you. We will, of course, come back to you in just a few moments' time. Let's go to Dr. Hector Bonilla. You're the co-director at the Stanford Post-Acute COVID-19 Syndrome Clinic. That is the name in full. But just tell me a little bit about the clinic and who you've been treating.
I think the clinic started with I was part of the trials or looking for therapeutics to take care of people with acute COVID. And we found out after the trials, many people end up with symptoms. So we're kind of concerned maybe those people develop a long-term consequence of this virus. And then we found out, yes, for in reality, those people end up with some problems. A significant amount of the population, the people have a very mild disease. Those people have maybe mild COVID, and then after a few weeks after the resolution of the infection, the patient experience all the severe symptoms that most of you, I think, have been experienced with the people. Fatigue be the main symptoms, and sometimes can be very incapacitated. People that are not able to get out from bed. associated with other symptoms like the cognitive function, people call brain fog, and the unrefreshing sleep. And there are some symptoms that resemble autonomic dysfunction, the orthostatic intolerance, the tachycardia, and other symptoms.
Yeah.
So this is very complex and more complex than we expected, but sometimes it have similarities with something that have been known before, like a chronic fatigue syndrome. So maybe it's another part of syndromes.
If you can, I mean, you also look at ME and chronic fatigue syndrome as well. I know we have talked about this on the show, but quite some time ago, probably about a year ago now. Could you talk about how COVID, whether it is linked to ME and CFS, chronic fatigue syndrome?
I think if you look at the phenotypics, how the clinical presentation of those people have symptoms, the symptoms are very, very similar. And we have, in our clinic, we analyzed the data from the first 140 patients with post-COVID. And those people have been sick for more than 300 days. So have been long days with kind of illness. And we found out the most common symptoms in those populations were first, fatigue, post exertional malaise, brain fog, unrefreshing sleep, insomnia, headaches. They are the same most common symptoms that we observe in those kind of populations. And we're looking for what happened in chronic fatigue populations, almost overlap the symptoms in that kind of population.
Right.
The fatigue, the brain fog, and refreshing sleep. So maybe this kind of long COVID we see after COVID-19 is another post-viral illness that have been reported before. If you look at the history in the coronavirus, MERS and SARS, people who recover, they end up having the same kind of symptoms. Then it's not only a coronavirus have been reported after influenza. Around 10% of the people experience this kind of problems. In my clinic, I have people the day one report herpes simplex 1, EBV, and the chickenpox viruses, dengue, Zika virus. There are multiple viruses that can trigger all this kind of change or symptomatology. The basis is not clear, possible alteration in the immune system. Many theories have been proposed now. In long COVID, people start talking possible microclasts could be one of the factors, persistent viruses and other factors, or possible people have combination all of them.
Okay.
Not only one, because some people respond to one therapy, other people, they don't respond. And maybe people need to have a combination therapy to take care of these problems.
Yeah. Okay. All right. We've got some questions for you as well a little bit later on, probably after the news, after about 11:30. So do stay with us, please, Dr. Bonilla. Let's welcome along Dr. Eleanor Draeger. She's a consultant and medical writer who caught long COVID back in February. Good evening to you, Eleanor.
Hi.
Hello. Tell me about your symptoms. How is long COVID affecting you?
So it was interesting because you talked about reinfection. I had COVID the first time in August 2021 and made a full recovery. It took a few months, but I recovered. And then I had it again in February 2022. And since then, I have been off work completely. In fact, I'm due to start a very slow phased return on Monday. But starting 2 hours a day, 3 days a week, because that's the most the occupational health think that I can manage. My work, and I work in the NHS as a consultant in sexual health and HIV. So at least one of my episodes of COVID was almost certainly caught at work, although I do have school-age children. And in the UK, many of the waves of COVID have been prompted by people going back to school. In fact, I joyfully had COVID again 2 weeks ago.
Oh, goodness.
So I just wonder if now I'm going to get acute COVID every 6 months forever. And that's despite having all the vaccinations that have never been recommended.
Yeah. Tell me about your symptoms, Eleanor. What are you experiencing? Is it a vast array or are there quite specific ones in your case?
So no, it's a variety. The worst one at the beginning was definitely the fatigue. I couldn't get out of bed for several days, missed several meals because I was too unwell to make it to the kitchen. At one point, I bought 2 kettles so that I could make myself a cup of tea during the day because I didn't have the energy to walk downstairs to the kitchen and make a cup of tea and come back up again. I've also got brain fog, which is, it's a weird symptom. It feels like my brain is buzzing. And if I look at a screen for too long, more than like half an hour to an hour, then it's intolerable and I have to lie down. And I lose words. So it's like a word finding difficulty. So I know what I'm trying to say, but it doesn't come out. And then the post exertional malaise, which I'm ashamed to say as a doctor, I had never heard of before I got it myself, which is where if I walk for more than about 50 meters, I get pain in my legs. And if I do more exertion, either cognitive or emotional or physical, all of my symptoms get worse. And the orthostatic intolerance is, where you feel dizzy when you stand up and your heart rate goes really high.
Okay.
That is so bad for me that in order to go back to work, I've had to buy a mobility scooter because I'm not able to do the walk from my car to the clinic. I am well enough, I believe, to do the clinic for 2 hours, to sit up in a chair. I can sit up in a chair, that's fine, but I can't stand up for too long. So if I was the kind of doctor that needed to do a ward round and walk around the whole hospital, I would need to do that on a scooter, or I wouldn't be able to do that at all.
Gosh, are you worried about going back to work, Eleanor? And have you agreed with the people that you work with that it kind of will have to be a kind of go back and see how it goes? Because presumably you can't think about committing to anything really, because you just don't know how you're going to react, do you, when you go back?
No, not at all. So I've been working, my boss and my clinic have been amazing, like so helpful and supportive the whole time. And I've worked really closely with them in occupational health. And the agreement is that I normally work in the NHS 3 days a week, and I am a sex education trainer 2 days a week. Obviously, all of that, I haven't been doing any of that work for this time. And while I'm doing my phased return in the NHS, I'm only doing NHS work. And like I said, starting 2 hours a day. But of course, I'm apprehensive because I've done a lot of things at home to try and replicate being at work. But ultimately, I can't actually do my job at home because I'm a doctor. I have to go and see patients in clinic. And I don't know what it's going to be like until I get there.
Yeah.
So, yes, it's intimidating.
Yeah, of course it is. Of course it is. Well, look, thank you for joining us tonight. I'm looking forward to asking quite a few questions. We've got some questions from listeners, and I'll try and aim those at you appropriately, if that's okay. We may not get through them all, but I certainly would like to get through the majority of them. If you've got a question to send in, by the way, #TimesRadio if you're tweeting, or 87222, start your message with the word Times if you are going to send a text. There'll be more from our big Friday night discussion as we look at long COVID with our experts, our guests, people who have experienced it and may well be going through something similar to you at the moment. Dr. Hector Bonilla with us, Claire Hastie of the Long COVID Support Group, and Dr. Eleanor Draeger. We'll be back with more after the news with Rob Malarkey. Good evening to you. Kate Borsay with you here until 1 a.m. We're in the middle of our big Friday night discussion, and we are returning to long COVID, something we've been talking about for many years here on the programme, 2 years since we launched effectively, trying to keep the spotlight on it, really, trying to gain an understanding and an increased understanding as the months go by into what kind of research and development, advances in treatments so that there is for long COVID. 2 million people thought to be suffering from long COVID in the UK at the moment. It is a sizable problem, not just in the UK, but around the world as well. This evening, we're joined by Claire Hastie, who is co-founder of the Long COVID Support Group, and also she set up the charity as well, Long COVID Support. We're also joined by Dr. Hector Bonilla, who is the co-director of the Stanford Post-Acute COVID-19 Syndrome Clinic, looking at research and advances in treatment. And we've also been speaking to Dr. Eleanor Draeger as well, who is a consultant and a medical writer. She works within the NHS, and she caught long COVID back in February and is due to return to work, working a few hours each day from next week. I've got plenty of questions in for you, and I'm going to try and aim these appropriately if I can. Just a sort of a first person account here really from Stuart Cotterill, who's got in touch to say 2 years and 5 months and I'm still pretty much housebound due to severe breathlessness. I've unbelievably acute fatigue, which means that I'm back in bed nearly every day by 3 o'clock. I have brain fog, all major joints ache constantly, tinnitus and many other problems. It's horrific. I'll come to you on this one, Claire Hastie. Obviously, you have seen some amount of recovery in your symptoms. How many people within the support group are like Stuart here, still dogged by really, acute fatigue, really awful symptoms, some, 2.5 years later?
The answer is many, many, many. I think I'm in a minority. We don't have any stats, but I wouldn't say I'm recovered like I was before COVID by any means. I'm just able to live a decent life. But I am in the minority. Many, many people who've been ill even as long as I have, which is more than 2.5 years now, are unable to work at all, having to use mobility scooters to leave the house at all, unable to function cognitively or undertake their caring responsibilities or education. So, I'm so sorry to hear Stuart, but unfortunately he's not alone. Too many people have got this and are still getting this.
Yeah. Dr. Hector Bonilla, how many of your patients are suffering and have been suffering with the effects of long COVID for a very sizable amount of time, like Stuart? And is there, are there sensible therapies out there for them? What does treatment look like at the moment for long COVID?
I think whatever we do is going to be like a off-label therapies. We don't understand this condition very well. So understand the pathobiology of this kind of conditions is very, very important, because in this way we can address therapeutics target specific symptoms on those kind of patients. Patients experience a lot cognitive function, or people experience possible reactivation of the viruses. So it's important to understand every single symptom, what this means and what's behind those kind of symptoms. I cannot just propose any therapies in this kind of population. The things I can suggest to do is extrapolate something we do in patients with chronic fatigue, is try to pace activities. Resting is very important. Don't overdo things. Resting mentally, physically, avoid stress is very important. Maybe good nutrition is important in this kind of patients. It's something like I recommended in this kind of patients until we have a better understanding of this kind of.
Yeah. So what you're saying there is, probably what Stuart's heard for, over these 2.5 years, really: pace your activities, rest, avoid stress, good nutrition, good eating habits. There is research going on, isn't there? And there's sort of several different theories, Dr. Hector Bonilla, and several different projects. Some are looking at blood clots that people have been experiencing. Some are looking at antibodies and that COVID may stimulate or cause trouble by stimulating the immune system, causing the immune system to kind of turn on itself. Is there enough research going on, and is there any significant development really within the last few months or so as a result of some of this research, which is largely ongoing at the moment, isn't it?
Yes, the research. The problem with research is it takes time before we got the experiments, before we got the results. It does happen overnight, but I think we are learning quite a few things. One, we see some changes in the immune system, changes in inflammatory response in patients with cytokines. We saw brain scan that show possible brain images that show changes in the brain. Autopsy finding that show persistent virus in different organs in the body. And this one study just came out in preprint from NIH that found out a couple of patients who died 265 days. There still has remained virus in the body. They found in the brain as well in other organs. So the theory behind a persistent virus is one theory have been proposed and still very attractive.
So that's theory. COVID, the COVID virus remaining in the body for a significant amount of time. And as you said, in someone who has sadly died, when their body's gone through the autopsy procedure or when investigations have been done, COVID has been found in their system still up to a year after.
Yes, it's correct.
Yeah. Okay, all right. We will talk more in just a moment, I'm sure. Let's look through some more of the questions going on at the moment here through on social media, and also you've been texting in with your questions as well. Sean Maguire says, I've been diagnosed with post-COVID MCAS, which is mast cell activation syndrome. It's like a repeated repeated allergic reactions from my brief look up on Google, I have to say. I'm not an expert in this. But that is someone who's been diagnosed with a condition that they didn't have when they're in their sort of post-COVID state. How common is this? And what's the prognosis RE recovery? Claire, is this one that you can take? You know, people being diagnosed with, you know, all sorts of strange conditions seemingly in that post-COVID period.
Yes, mast cell activation is a term that I and many of us in our cohorts have learned to become familiar with. Essentially, lots of people develop intolerances to food, but also even developing allergies to their own pets or hair products they've used forever. And I certainly used to have enormous symptom flares eating the most innocent-looking foods. And that's incredibly common. It's to do with histamine levels and your body's ability to regulate those. So that is very common. Being diagnosed with it is not so common because getting access to health professionals at all is difficult. Being believed and then having, it's a condition that isn't well understood, nor is dysautonomia, which again is very, very common with people with long COVID.
All right. Okay, good. Eleanor, I'm going to aim one to you here. Of course, Eleanor joins us as a case study, but also rather conveniently, she's a doctor as well. So I'm going to plug into your foundation of medical knowledge here. But it's an interesting question from Anne-Marie. 1 year of long COVID, she says, it's been hell. My question is, why do we separate COVID from long COVID? When the risk of COVID is discussed, hospitalisation and death figures are reported, but not in terms of the avalanche of long COVID. Why? It means that people are unaware of the true scale or severity of it. And I'm sort of, although you're not an expert, I'm sure that you can pick up on the theme of that. You know, why are we not getting proper data on long COVID compared to COVID?
I mean, I could talk for a long time about why we're not doing all sorts of things in relation to COVID in this country. We've known that long COVID was a thing since 3 months into the first wave. I know people who, before I got COVID, I knew people who had long COVID, who'd caught it in the first wave and were not being believed. And it seems like there's almost a deliberate attempt by government, by people who want us to all go back to work, that it's okay for us to not wear masks and to not do these things. And I worry greatly for what is going to happen to the country, to the world, because the amount of people with long COVID is only going to increase. So my example is that I caught COVID once, recovered, then I caught COVID again, got long COVID. And it seems that the risk of having long COVID increases with each reinfection that you have. And in terms of why are there two different things, I'm going to liken it to something that I know a lot about as an HIV doctor. There's HIV infection and there's AIDS. Now, I am not saying that long COVID is AIDS because it isn't, but long COVID is behaving very similarly to that in that it looks very much to me like a persistent infection of some kind. So there's clearly some virus somewhere in the body that is still causing problems. And the problems people are having are in their nervous system, in their gut, in their blood vessels, like all over the body. And also significantly with their immune systems as well. So, for example, the rates of shingles in people over the age of 50 has gone up massively over the last couple of years. The rates of new heart attacks and stroke have gone up significantly. And it is believed by a lot of people that that is because of long COVID causing a problem with the blood vessels, which is not picked up by some of the tests. So I had chest pain at the beginning of my long COVID for about 3 months. And I still get it now sometimes if I'm stressed or if my heart rate goes too high. And given my heart rate goes up when I brush my teeth, I can get chest pain doing something really simple like grating cheese. It's ridiculous. But I went to A&E, obviously, because I had chest pain in the middle of the night, and I went to A&E like this is the right thing to do. And they did an ECG, of course, and they, checked my oxygen levels, and they said, "Oh, well, great, you're not having a heart attack, brilliant, you can go home." So they sent me home, still with chest pain, which just seems amazing to me. Like, I'm a woman in my late 40s with chest pain, and because the ECG was normal, they sent me home. There must be something going on there. I can't believe that there's nothing wrong with me and that I've just randomly got chest pain that comes on with exertion, with stress, with my heart rate going too high. But so it seems to me that we must be doing the wrong test. So I'm not trying to criticize the NHS. I mean, it's on its knees at the moment. People are doing the best they can, but I think we don't have the right test. And in the very beginning of the HIV epidemic, we didn't have the right test either. And we didn't know why people were getting so sick, and we didn't know what the problem was. But now people with HIV can be given the right kind of drugs and told that they will never get AIDS. And I look after patients with HIV, and they have a normal life expectancy, and they will die of something other than the HIV, of old age or of some other thing.
So that's very, very targeted help, isn't it? Because there has been focus and funding and research, and so then therefore medication to be able to do that in a targeted way. So it feels like, Dr. Bonilla, some of the symptoms of COVID are so wide-ranging, that there is definitely concerns with heart arrhythmias, as I've said, clotting in the lungs as well, that there is all manner of symptoms. It's absolutely vast. So is that the problem, why it's difficult to be targeted? Because there are, at the moment, so many different symptoms that we can't join them all together, that doctors, researchers can't really be definitive about it because it's too big, it's too wide-ranging.
In my opinion, I think this long COVID as well as chronic fatigue is a neuroinflammatory conditions. When the brain has been compromised, and the brain is the main computer, and we experience sometimes, like I call phantom symptoms, that is related with depends what area of the brain have been affected. There's evidence about PET MRIs in patients with chronic fatigue. When they find out specific areas of the brain involved, the amygdala, hippocampus, the thalamus, the cingulate, and the midbrain. And those areas can explain most of the symptoms. For example, midbrain is area of autonomic symptoms. We can see this autonomy is because of this area being compromised. The amygdala, hippocampus areas, they have in behavior, anxiety disorder, the brain fog, the cognitive dysfunction.
Yeah, so you're saying everything. So you're saying everything, in your opinion, in the work you've done so far, relates back to the brain. So the brain is the main computer, and when you look into all of these other symptoms affecting lungs, heart, and everything else, you think that it can all go back to the brain?
Yes, it's correct. There's only autopsy findings of brain of patients with COVID. They found evidence of neuroinflammatory conditions, increase of microglia cell. The microglia cell, the inflammatory cells in the brain have been activated. And this kind of activation may be leading to a dysfunction in the main computer, some click or glitch. And those glitches maybe can explain many of the symptoms, because when we doctors, we do exams on those patients. They do CTs, MRIs, PFTs.
Okay. Yeah.
They don't find anything. So everything's
okay.
normal.
I'm going to give you this one quickly. We are running short of time, as we always seem to do on these panels. But if you could be brief on this one, that would be much appreciated, Dr. Hector Bonilla. Eddie Coulston's been in touch via text and said, I've had MS for about 20 years. My ongoing symptoms are fatigue and brain fog. Is there any correlation?
I think maybe the areas of the brain have been associated with the striatum. Damage in that area have been linked with fatigue. People with MS and people with Parkinson's, strokes, or injury in these areas have been associated with fatigue. In the patient with chronic fatigue syndrome have been involved in areas of inflammation. They can explain many of the symptoms of fatigue related with the brain, because physically those people, they lose complete normal. The other reason they have been dismissed by many physicians, because the patient feels very crappy and the patient looks fine. And it's very easy to be dismissed about their symptoms.
Yeah. Okay. Claire Hastie, for you, we do need to talk about children and young people. And I know Long COVID Kids Scotland's been in touch. I know you do a lot of work with long COVID in children as well. And we're being asked to talk about it. What is our understanding at the moment with children and young people? Do they experience different symptoms at all when we talk about long COVID? What is definable, what is notable about children who are suffering from long COVID, apart from the fact that they don't really seem to be getting enough support because there's perhaps too much focus on adults and not enough research going into children?
You've taken the words out of my mouth. There is not enough research. There's not enough research going on or not enough appropriate research or urgently enough research going on in long COVID generally, and even less so in children. And there seems to be a huge overhang from the early days of the pandemic, when it was thought and stated that children weren't affected by this, which was never true. My children fell ill in the first wave, as did many children who have yet to recover. So in terms of symptoms, there's a huge overlap. There's perhaps signs that maybe things like rashes are potentially more common, but generally I think that, and maybe possibly neuropsych symptoms. So when my son's had seizures for lots of months, which thankfully seem to be less frequent now. But yeah, not enough attention on adults or especially not children. Long COVID Kids as a charity does amazing work. So I do recommend their website.
Yeah. Look, thank you all so much. I feel like, again, it feels like we've barely scratched the surface, but we will keep revisiting it. I absolutely promise. Thank you so much to all of our panellists that you've been hearing just there, the voice of Claire Hastie, co-founder of the Long COVID Support Group. Do check them out on Facebook and also on Twitter as well. You'll find links via my Twitter feed. So thank you to you, Claire, once again. Thank you very much to Dr. Eleanor Draeger. She is an NHS consultant. She's a medical writer. She's been giving us her experience of long COVID, but also added in some great astute medical observations as well for us. Good luck with your return to work, Eleanor. I hope it all goes okay. And Dr. Hector Bonilla, co-founder of the Stanford Post-Acute COVID-19 Syndrome Clinic, just getting us up to date on some of the research and latest understanding. Thank you to all of you for joining us here on Times Radio.